Welcome to my world. Another day, another time for knowledge acquisition. Knowledge is power, health is wealth. Today, how I'm trying to expose us to marriage pain counseling. Usually, the role the laboratory play is not so exposed when you talk of marriage counseling, but the laboratory is very important, very vital to the outcome, that is the findings of what the partners are. Concept definition. There is a need for us to understand what I mean by marriage pain counseling. It's like saying the preconception screening test. And when you talk of preconception screening test, you want to know the status of the husband to be and the wife to be, so that if they are both carriers, they will not go and give birth to babies that are defective, one way or the other, having to carry diseases that will cause serious suffering for that baby. Now let's look at the list of diseases that can be inherited from parents who carry these various traits. It could be recessive or dominant traits, or could also be sex-linked chromosomal diseases. They are all listed so that we can be aware of the seriousness and sufferings the baby can undergo. Congenital adrenal hyperplasia, that has to do with the adrenal cortisol hormone, the cystic fibrosis, profuse sweating, and the child not living long, probably up to 40 years. Duchenne muscular dystrophy, the child may not even live, the life expectancy may not even extend up to 12-15 years. Hemophilia A, serious bleeding from the nose, is a very common serious bleeding, clotting problem. There is also Huntington disease, polycystic kidney disease, sickle cell anemia, very popular, especially in Africa, where children, sicklers, die young. Some are now being taken care of because of the awareness of the disease and the various regimens that can be taken to prevent serious complications of this disease. There is also albinism, and so yes, there is the non-genetic test that could be done. Semen analysis for male, and the female has to do with checking if there are hormones, necessary hormones that could allow for conception. Because, like I said, it's all about preconception screening test. The HIV would show that the baby would not come down with HIV if the parents are not positive. So the status of the parents has to be known. They would be parents. VDRL is all these are sexually transmitted diseases. VDRL, hepatitis B, hepatitis antigen, and hepatitis C, B, diabetes test, TSH, blood group rhesus compatibility. Down syndrome is age-related. It's always a problem of mutation, and old people are not advised to probably marry. Let us look now at what is very common with genetic problems. This is a very good example. It applies to almost all genetic diseases. Inheritance of cystic fibrosis. This is how it is inherited. It is an autosomal recessive problem, disorder. You can see both parents are carriers in this list, and because they are carriers, it means they have dominant cells, so they will not present, since they will not present with cystic fibrosis. So it is now their offspring that 1 in 4 of them will be affected, and the affected child is the unlucky one that could really cause serious problem in marriage, that even could result in the dissolution of the marriage, because the child will be often showing difficulty in breathing and what have you. It applies to sickle cell diseases too, and also to other. Let us now look at the chromosome. This is a typical picture of the chromosome. When you look at it, it's labeled 1, 2, 3, 4 to 23. The 23rd is not written, but that is the sex hormone, which is representing male. This chromosome is for male, a male child or a male, and that's why you have the last hormone showing X and Y. The Y chromosome is very short. Every chromosome you see contains the genes. The genes contains all the information necessary that the person now appear with physically that we see. So, but what is on the left of the X is also what is on the right side of the chromosome. So the X chromosome is what is called the autosomal, while the X and Y chromosome is called the sex chromosome. The ones that is a defect in the X, that is when it is called the recessive. And the right, you will complement it by having a dominant gene. So the child will not present with the disease if there is a dominant gene, and that is. The laboratory results are usually advisory of sort, but where there is a government policy that people should do the test in order to reduce probably the population of children with this disorder, then the couple will have to shelve their plans and their marriage plan and live apart. All the highlights that I've shown are all about preconception screening tests to check the possibility of having a healthy baby, and not my interest. The interest shown is different from the one that will result in aborting babies who are not showing who are showing the disorder, because this is what prenatal test is all about. And I'm trying to say you can't do these other tests before prenatal. Let's look at this example. It is a fingerprinting, we call it fingerprinting genetic test, and we can just use it to explain a little. You can see the horizontal line, the movement of the genes. S2 is very similar to the E, which shows that the person carries the gene of what let's call sickle cell disease, or any of the diseases that we have. And then S1 does not carry it because it has no resemblance with it. And that is how it is easily concluded that this is surely a probability of over 95 or more than 99%. Prevention is better than cure, so the saying goes. It is better to prevent pains, marriage pains. So in conclusion, I would just urge that everybody that is living, whether you are married, or you have children or you don't have children, but at least you have relations, you have friends, you have loved ones, that you can pass on this message that there are tests, genetic testings, the necessity of preventing marriage pains. It is by knowing your genetic makeup, so that once you have the information on certain factors, then you just know that the partner you have to be married to or choose in future must be somebody that is having something complementary that will not create pains that you are unprepared for. So if you like this my video presentation, press the like button, subscribe, and be sure to look just the channel. There are so many health topics on my channel. Just look for more to look and you'll be happy you did.